Hi, this is another episode of the Family Food Series that is about safety. I included this. This is one of the last episodes that I'll be doing. But I included this because so many teens are getting vaccinated early for STIs or STDs. And a lot of women and young girls and people that, develop STIs or STDs or endometriosis or some of the issues that are related to your menstrual cycle can have some pelvic floor disorders. Men can have pelvic floor disorders, but I believe the prevalence is mostly that we see it in women. And I believe if you go to a urologist and try to get the statistics related to that, or gynecologist, you would find that if those were meshed together, you would see, in addition to gastroenterology, so that's 3 components, because these are all together down in that lower pelvis. And women, of course, have 3 areas that are right together, and a lot of people have issues related to that. So tonight's talk is a little bit different. It's about pelvic floor disorders. And I came across this because there were a lot of, I again follow a lot of people, and a lot of people reach out to me and they want to discuss these issues that they're dealing with. Some of them are related to pancreatitis, and they'll tell me that they were diagnosed with PCOS, or they were diagnosed with some other inflammatory condition in the pelvis. Maybe it's inflammatory bowel disorder, inflammatory IBS, or they're having some issues with the heavy bleeding with their periods, and they're having other things that they're seeing with their uterus, or a lot of urinary tract infections and trouble with holding their urine, or urgency or frequency, or whatever it is. It's related to the entire pelvis, what's going on in the pelvis, and then related to the hormones and the neurogenic part, the nerves that are related to these organs down in the pelvis. So I'm going to share my screen because I came across something in Yale Medicine, and I thought this is so valuable and so helpful, because there's hope with prevention, or just intervention with prevention, stopping in the tracks of progression of disease. And that's where you want to be. You recognize something's wrong, something's totally dysfunctional there. Maybe you've got prolapses, maybe there's invasions from one section to the other. I mean, there's so many things that can occur, even with, like I said, STIs, sexually transmitted infections, or sometimes it's either bacterial, it's viral, or parasitic. Some of these things can take over in that lower region and lead to some pretty unfortunate situations. And a lot of people remember Farrah Fawcett, and people can relate to celebrities that have had issues with maybe colorectal cancer or something. Some of these are conditions that are related maybe to STIs, or things, a non-functional digestive system, intestine, where your foods aren't making it all the way down to where they need to be, and they're not being, going through that entire process. And so it's leading to a really unhealthy scenario for that lower part of those 3 combined areas, which is the anus, which is part of the colorectal area. You've got the vagina, and then you have the urethra, and those are all, right in a row. For men, of course, it's it's similar, but their, urethra goes a little longer, so they don't have to worry as much. And when men start having urinary tract infections, you must back it up and say what's going on in the gut and how much yeast overgrowth is going on in their bodies. So, because, this whole thing with jock itch and things like that, you don't really think about it. You just think, oh, I just got a tree right down there. But actually, it is a full body system approach. So as I mentioned, I'm going to share the screen and hopefully you'll be able to see what I'm looking at. Let's see if I can get this. Okay. I am hoping that you're able to see this. Pelvic floor disorders. I'm going to move myself up a little bit. So they give a scenario, and they're going over basic anatomy and physiology related to this. So I want to just say this is appropriate for teens and above, because literally they need to know their bodies, and there's a lot involved with, even the idea or the introduction of, first of all, you're having your period, men are going through different things, and all the excitability of all these young kids. And a lot of things are happening at one time, and those teen years are so, so precious, because you're not only, maybe getting sexually desirable and all these changes are occurring, but even as you go further down the road, you're still trying to figure out what's going on with those lower parts of your body. So you see that the ureters right here on either side, just above the bladder, come into the bladder right in the back. So you'll see that. Now, I was married to someone who was a urologist for 20, I was married to him for 28 years. It's been 33. I've learned a lot from his experience as a urologist and dealing with people that come to him. I also dealt a lot with my own personal experiences, and as a nurse, I was putting catheters in people nonstop, literally every day. So I understood, that what was going on with some of this, but I've learned since that, there's some other, not just functional aspects of it, but all the intermediaries that play a role in how the bladder functions, how the urine is made, why it's occurring that maybe the urine isn't leaving the bladder, why it gets obstructed, these stones that are being created up in the kidneys, and many different aspects of the urinary tract. But that urinary tract, so the bladder sits right down in your pelvis, and so it's a huge muscle that contracts, just like any of the muscles in your body that contract. So it's got that ability to open and close and contract. And when it's not working properly, it can fill and be filled and not empty. The reasoning and things behind that will go into it, but just so that you know, that bladder is just like the gallbladder. It's a bladder, and we talked about the gallbladder in a previous episode. This is a releasing of the urine. So the urine collects in the bladder, the urinary bladder, and then it's released when it's supposed to release that urine. Sometimes it's hypersensitive. Sometimes it's, the nerves that go to it aren't functioning properly. There's not enough the electrolyte, there's imbalances that don't allow the cells to participate as they should, or the cells inside, because of a bacterial infection, a yeast overgrowth, or like I said, a virus or whatever, it can cause overgrowths in here and cause some issues with bladder incontinence and just blockages. So you see that there's a sphincter. Now there's sphincters all over the body in different places for different purposes. They allow a release. They hold, they constrict. That's their purpose, to allow the bladder to fill up with some urine. And then when the urine is met at a level that says, okay, it's time for me to empty, then it triggers all kinds of little alarms, and then that sphincter is released, and the bladder releases, contracts, and then the water comes out, or the urine. When these things are all discombobulated, when things aren't working properly for the communication process with the proper nutrients that surround everything, then it can be a major issue. And a lot of people not only have incontinence that leads to either having a Foley catheter or to having, a leg bag or wearing diapers, but it's the opposite, where they can't empty their bladder and it just constricts, and you're having urinary retention. And so it goes from one extreme to the other. Why is someone retaining that fluid? What's going on in the body that it's being triggered to hold? Maybe you're dehydrated and it says, you know what, you don't have enough water, I can't let you go. Or maybe one of your electrolytes is out of balance. Okay, so we're going to go to, there's something called the trigone, and that goes down further, and that's related to bladder emptying and holding it in place. There's the perineum muscle underneath. There's a levator ani muscle, and I'm not sure if they say levator. I call it levator ani. And then there's the urethra. You see it goes straight through where these muscles are holding it in place. And the pubic bone is right behind there. So, just looking at that picture, I want you to imagine that if there's a bad infection and it's not being treated properly, or your body does not have the proper microbiome to address these issues, then those bacterial or viral infections can take over in those areas. And you would see some issues related to, the muscles not working properly. And the bones aching because there's releases here and there of different chemicals and communications, as I mentioned, for triggering, what the responses are supposed to be. So it says here, the bladder is composed of multiple cellular layers. The mucosal layer is epithelial cells, okay? The contraction of the bladder is controlled by the detrusor muscles, composed of 3 smooth muscle layers. And they are innervated by, here we go, we're talking about both the parasympathetic and the sympathetic branches of the nervous system. And this is where the nervous system is so important to know about stress responses, where you're stuck in your body. I know that many times I would go somewhere and I would drink something and immediately would have to go to the bathroom. There aren't a lot of people that have those high stress responses, but it was also possibly that my body was advanced more with diabetes. So, it's hard to determine just by looking at one glucose level of where you are with that diabetic part, but parasympathetic and sympathetic branches. Let's hone in on that, focus on that. People that have lost their bowel bladder responses are maybe dealing with some of these issues. Okay, and then it says muscarinic. Okay, I am not getting into the details of pronouncing. Somebody else can correct me about that. Beta adrenergic receptors, respectively. Okay, so these are those branches of parasympathetic and sympathetic. The urethral sphincter is composed of striated muscles. So there's different types of muscles. They react and respond differently. and they're related to those innervations. Now that the striated muscles are innervated by the somatic nervous system, and that is the pudendal nerve. And you know that if some of these nerves have any pressure on them for long periods of time, they can become numb and or non-functional. And if you're diabetic, you know that neuropathies and neuritis and things like this occur with the nerves if you're improperly nutritionally connected with the B vitamins, and you're not absorbing your foods. Things are not going properly right with your pancreas, and it's not working, and you're not able to digest your foods. Okay, so let's go over to here real quick, and I hope that you can see all this. So this is more about those three areas I talked about. You can see the urethra is up here in the front. Then you've got the vagina. That whole area is in the middle. And of course, that is opened during intercourse. And then back here is your rectal area where, that's where your stool should be coming out. And the part of the things that, a lot of people don't realize is that if you're not properly creating stool or, anything that is evacuating from your rectum is not, if it's hard rocks or, if it's all water, this becomes agitated and inflamed. So no matter which way, if things are not in the proper environment for it to properly work, and things aren't working in your intestines, things aren't working in your bladder like they should, you get kidney stones and things are blocked. Okay, these things can cause so many issues and dysfunctional problems in the pelvic floor. So let's go on further because there's something on here that I just so love. Okay. Continence is defined as the ability to store urine until voluntary emptying of the bladder. Okay, so like I said, there's little triggers and signals that are sent for this to all occur. During the filling stage, the detrusor muscles of the bladder relax due to the sympathetic nerve activation of beta adrenergic receptors of the dome or the top of the bladder. And at the same time, the striated urogenital sphincter muscles contract. So it's happening at the same time. During voiding, when you go to the bathroom, parasympathetic nerves activate muscarinic receptors to cause detrusor muscle contraction in the striated muscles of the urogenital sphincter relax to allow the void. Okay, so it's allowing it to release. So they go into the connective tissue in the vaginal wall and the anatomy of that entire area. And the levator ani muscles are the main pelvic floor muscles, and are composed of striated muscles. These muscles can sustain injury actually during childbirth, which contributes to pelvic organ prolapse. That is very true. They are now recognizing, though, that when a woman is nourished properly prior to pregnancy and practices natural ways of working with her musculature throughout her entire body, releasing stress and moving in different ways, you can alleviate a lot of this so that there's no prolapse, there's no tears. A lot of this can be preventative, but we're going to go forward because right now they're just telling us that some of these things can happen during a delivery. And many times there's so many people that are getting C-sections that Even with C-sections, things can occur because they're cutting, they're removing the baby, and then you might be dealing with infection afterwards, as I was. Okay, so the muscles can sustain injury during childbirth. Connective tissue within the pelvis also contributes to maintaining normal pelvic anatomy. So we're talking about those connective tissues. If there's an infection, these can be invaded. This can all just get wishy-washy down there, not working together. The muscles become weak. These areas can, cancer can invade, and the cancers are caused by either a virus, a bacteria, a hormonal imbalance of some sort, the ovarian tissue or whatever is that you're dealing with can cause these problems. So the arcus tendinous fascia pelvis provides lateral and apical suspension of the anterior vagina. So there's some suspension of the vagina, and the uterosacral ligaments provide apical support by suspending the uterus, cervix, and upper vagina to the sacrum. So they have their place. They're there with different muscles and ligaments, and they're all in their space and place. The cardinal ligaments formed by the condensation of connective tissue around the uterine vascular bundle also attach to cervix and fan out laterally to suspend the apical vagina. Okay, now when you hear of prolapses and things like this has all gone downhill. You know, that is that your pelvic health is something that you can work on. And every day, a woman really needs to focus on this, especially if she's having children. And then there are some women that are heavy lifters, whether you're a nurse or you're in some kind of a job where you're food handling or you're doing exercises where you're doing heavy lifting. These put extra stress on these muscles and these areas of the body. So you got to take that into consideration. Anything that you do is going to compound the factors that are related to your pelvic floor. Okay, so the basic understanding of patients presenting with pelvic floor disorders and okay, we're going to talk about level 2, the risk factors, symptoms, and physical exams formulates initial differential diagnosis. What kind of diagnosis are you looking for? It's going to depend on what is going on with that client. Okay, so or with you, how many different factors are there that are making this happen? You know, if you're drinking a lot of sugary products and things, it's just going to wipe a lot of things out, and you might become super dehydrated or whatever. We'll get into that. So they're saying that the risk factors are increasing age, obesity, of course, parity, whether or not you've had children, COPD, chronic cough, and smoking. So let's talk about stress urinary incontinence. And I just want to check on something to make sure I'm not making a mistake with this, because I have in the past. Parity. Okay, that does not say what I just said. I thought that parity meant, giving birth to an infant or infants alive. Okay, so whether you've had miscarriages or whatever you're dealing with, we're definitely talking about these incidences with women. Let me see where I was. I'm going to get back. Okay, here we are. So we're going to go back up to this. Stress urinary incontinence. So mixed urinary incontinence. Now they're saying that there's stress and urge. Laughing, coughing, sneezing, or with physical exertion, when you start, any type of spilling, or, all of a sudden you sneeze and you feel urine come through. You're like, it's the most embarrassing thing, by the way, to ever have that happen. So why is the bladder leaking? Why do you have bladder leakage? And we talk about these things. Patients often report small, frequent losses of urine. I'm sure there's many people that are dealing with this, and it is a bit scary. So it's time, when you start leaking, if somebody's directing you towards adult diapers, you better start really taking it in that you got to do something to help yourself. Urge urinary incontinence. All of a sudden, you feel like you have to go to the bathroom all the time. So, and I told you that, you go someplace. I say from the mouth, if you are within 5 to 10 minutes of drinking something, you have a blood sugar issue. Immediately, I say it's either your parasympathetic and sympathetic nervous systems are way off track and your hormones are way off track. Because if you're drinking something with any kind of sugar in it or anything, and you have to go to the restroom immediately, you're dealing with a hormonal imbalance, and you probably are just very close to pre-diabetic, if not diabetic. So mixed urinary incontinence, overflow urinary incontinence, these are all factors related to too much of one thing affecting another. Functional urinary incontinence due to cognitive, functional, or mobility impairments. Okay, some of that is related to someone who's been in an auto accident, and they're tragically having issues with nerve innervation to those areas, and they've had some injury. Overflow urinary incontinence, an underactive bladder. Some of these are overactive, some of these are underactive, but you're not able to voluntarily empty your blood. That's when people start with the catheters and all these things. At the level of the urethra, there can be a kinking of the urethra due to advanced pelvic organ prolapse or iatrogenic obstruction of the urethra. Okay, now here is, which iatrogenic obstruction means that this is a natural obstruction that happened because of the prolapse. Okay, there are some other terminologies around the types of obstructions, and I don't want to get into those little terminologies. It can be a cause, something to cause this, okay? And this is what I love, that somebody made this. The disorders can present as urinary incontinence, and they have the mnemonic diapers. Nobody wants to be in adult diapers, right? Okay, so they're saying delirium. Now, I have seen people who are dealing literally with either Lyme's disease, acute bacterial infections, mold, anything that is related to yeast overgrowth, a combination of these things, or they're having STD, encephalitis from STDs. These can cause, you may not have that elevated temperature they're looking for, and you may be delirious. You can go through mania with some of these swings with your hormones and with things like that. So there's infections related to this. It says infection, urinary tract infection, atrophic vaginitis. So an inflammatory condition related to the vaginal canal and the vagina, and maybe it's becoming atrophied or shrinking up, because unfortunately they say use it or lose it, and in these situations there may be something going on in the vaginal canal. Pharmaceuticals. They're saying that these pharmaceuticals can be a part of or cause some of the issues. But I want you to really think about why you're taking these pharmaceuticals. What are you being treated for? What symptoms do you have? What are they associated to? What's going on? Diuretics. Diuretics like Lasix, they are giving you that to get rid of all excess fluid. And if your body is building up excess fluid, it's out of balance. It's out of balance and your body can't compensate for what you're putting in it, okay? Calcium channel blockers, what's that mean? We're gonna block calcium pathways. Why? Because maybe we're eating too much calcium. Maybe we're just overloading with calcium and they're gonna block it because if you give yourself too much calcium, it can throw your heart out of whack, it can throw your muscles out of whack. And then calcium and magnesium, it throws the magnesium way off. You give it way too much calcium, and then it's like you're going to be low in magnesium and you're going to be a little bit off your rocker. So these things can cause huge electrolyte imbalances, cause huge hormone imbalances, ACE inhibitors. Those are other medications that they've put you on that are going to relate it to your heart. Opioids, you know, because I want to go back because one of my episodes is on how calcium, sodium, potassium, we don't realize it, and sugar cause huge electrolyte imbalances that affect the heart. Okay, the sugar itself not only is going to dehydrate your body and set you up for more problems, it's going to put you in a place where there's not enough fluid in your bloodstream, where your red blood cells cannot properly function. They can't carry the oxygen, they can't carry the excess glucose. You're dehydrated because your body is trying to accommodate too much of those four things. And those are usually in processed foods and dairy and your grains, okay? Your grains, processed food, and dairy. So those things can cause so many. Muscle relaxants, here we go. If you're constantly having these contractions or these twitches and this is going on, your parasympathetics and sympathetics way off, and you're in a stress mode, tightened up. You know, some of these people with these contractures, their body is telling them something. They can't relax because they're getting the wrong nutrients. They're relying on the wrong foods. And to tell you the truth, your mouth and throat, it can sense when things are coming in. If you can't swallow, you better pay attention. If you're choking, you're coughing after you or during your eat, while you're eating, something about that food, you got too much of the same foods coming down the pipe, and your body's going to tell you. And then if you keep putting it in, the pain levels are going to go through the roof. So muscle relaxants, I was on every drug you could imagine. Don't want to go back there, and I hope you will want to move forward with taking steps. Never go off of a medication without telling your family practice physician or whoever you're working with. Never go off of anything. It should always be a weaning process. As you introduce the new foods to your body, because it's all an adjustment. It's got to make these adjustments. New food's coming in, it's good food, but I'm going to have to adjust because what I'm going to do is I'm going to get rid of the bad stuff. New food is helping me to renew things. I got to get rid of that bad stuff. So you're detoxifying. So that's why they talk about these elimination diets, detoxification. There's all kinds of distractions out there with diets and dieting. You have to get on the same page. We want things to work properly, to function, functional medicine. Okay, antihistamines. You got problems with your sinuses constantly. You're blowing your nose, you're stuffed up, you can't sleep. You're on a CPAP machine at night because you can't sleep because all the stuff that you ate during the day. 4 of my family members sleep with a CPAP machine. Okay. Antihistamines are working to reduce your responses. Okay, because you're in such high alert because maybe you have a leaky gut and things are flying into your bloodstream that shouldn't be there from your gut. The foods are going out, and then your body just can't keep up with everything that's going on. It gets confused and alert, and maybe you're totally inappropriate because you can't tell if you're going to laugh or cry because of all this stuff that's going on. You get leaky gut, you get leaky brain. You can get into a really mental health crisis with all these things. So pharmaceuticals, be very aware, wean off of them with your practitioner or work with a functional medicine coach, someone who's certified in understanding how to wean from medicines to a full functional diet, okay? A plan that works and where you're digesting food. Because there's a lot of little steps. There's little steps along the way. Psychological disorders, we just talked about. Mental health. You want to know if that food, is coming into your stomach and that you're not inflamed, causing inflammation of the esophagitis. First, it starts with what? What's your gums? Gingivitis, esophagitis. Then you get, the GERD, and then you get the stomach, chronic gastritis, duodenitis. Then you get all these other things. You get pancreatitis, hepatitis. The gallbladder starts screwing up. Okay, all these inflammatory, and then you get an inflammatory bowel disease. A lot of things can occur with introducing the wrong foods. Very difficult because you are going to have to take a new approach, see what foods you can grasp onto and replace for the ones that you loved. Now, I'm going to say I was an ice cream addict, I was a popcorn addict, and I was a just any kind of cookie and cake. Those 3 things. I was such an addict with that. I was eating salad, and I was eating some of the other foods just in small amounts. Mostly the carbs. And a lot of people don't understand how popcorn can be so dangerous to your health. I lived off of it. But the ice cream was with my peanut butter. And I believe that my ice cream addiction with peanut butter caused my children to be allergic to peanuts. That's my opinion. That's what I believe. And hopefully they will figure that out genetically because we were exposed to that. Now, all the grains and the peanuts and many nuts and many different foods have some mold connected to them. So if you've been eating a certain type of food over a period of time that's related to mold, maybe your body's going to fill it up with mold. I was exposed to black mold also, in addition to eating some foods that weren't properly maintained, refrigerated, because of the lifestyle I led as, growing up. And I don't want to get into that, but that's part of connections with food and where we come from. Excessive urine output, hyperglycemia. We're talking about too much sugar. It's just a trigger. Immediately, your body, when it's taking in things, it says, bam, 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 I'm going to trigger this. This goes over here. It's like a pinball machine. And then immediately it says, go to the bathroom. I know a couple of family members who were during their childhood, and I had 2 episodes where I peed my pants. It was the most embarrassing thing ever. Nobody wants to like do that in public. It's embarrassing. You don't want to lose your bowel or bladder. And then we're going to go to reduced mobility. If you do not, okay, I have a 5 points of awareness and then my 5 W's. The 5 points of awareness, my last pinky finger is activity and movement. When I had pancreatitis, I didn't know how important the movement part was, other than the fact I was trying to do extremes. So I would try to walk. I mean, I was walking miles trying to walk, but I wasn't eating properly. You can't eat a bad diet and then try to walk it off. Your body's not even functioning and you're trying to walk. So I didn't understand that. And so I was in severe pain. You're like a couch potato because you're in so much pain, you don't know which way to go. So, and I was drinking stuff and, it's very, very confusing. So reduced mobility, what I found was very simple movements. And what you're trying to do is get the lymphatic system to work. And the blood vessels, they run right alongside the lymphatic system. So you need your heart to pump. You need some fast movement, just small episodes. 10 minutes in the morning, 10 minutes at night, or in the middle of the day. Maybe you want to do your fast movement in the middle of the day, do your stretching in the morning and stretching at night. But 10 minutes, you can do simple movements that will get your lymphatics to move by just stretching with doing simple yoga moves. You don't have to go crazy going to all this stuff. Pick out which movement you're going to focus on. Maybe you're going to do 2 movements at each time. You're going to do the cat-cow, and you're going to focus on one other movement. Maybe it's going to be the Sphinx. Focus on those 2 movements. Do your deep breathing. Just get your mind and your body connected to the breathing. Okay, that's what you can do. Those in the morning and the evening. Do a little bit of fast movement in the afternoon. I think this might work. And I'd like to know if it does, if you're listening to this, because we're going to go to the next one, stool impactions. How many here have dealt with an impacted stool since the age of 8? Okay, years. Didn't go to the bathroom for like a week. Didn't know any better. My doctor says, you got hemorrhoids at 8 years old or 10, I can't remember. They had to do, they're doing rectal exams and saying you have hemorrhoids. Like, okay. And what they ordered at that time was, what everybody cod liver oil, because they knew that we were missing oils. We were missing the fats, but they didn't understand. They didn't ever say, you can't eat your pizza, you can't eat your pasta or your cookies. Nobody ever mentioned that. I don't know what they knew at that time. I believe they knew that these things were impacting our health. This is all I'm going to cover for tonight. There's more to this information, but diapers, mnemonic is just so classic, because you will end up in diapers if you do not stop right now and take care of yourself. Pelvic floor disorders. If you're having a lot of drainage, if you have any kind of sexually transmitted infection, there are some great antiviral natural remedies. I'm just going to go over this. This is from the medical medium, okay? I also have remedies from IFM, Institute of Functional Medicine, which I'll post below this talk, and also I have some from an oil company that does essential oils, because you can also drink teas and you can use essential oils. And I say everybody's dosage is individualized, because your toxicity level is very different than somebody else's. Your body, depending on how your bone size, because I reached my body size by the age of, I would say by the age of 20. I wasn't going to grow any further, but I ended up with pregnancies and everything else going up to 180 pounds. You know, I was very toxic. My body was like literally not working. I mean, I was having some major problems with the last one there, stool impactions. I mean, that was just constant. Okay, so let's go over what the medical medium offers. He says, order of importance. And this is for your immune system and aid your body in healing from viral effects, because viruses are very difficult. They can invade a lot of cells if you do not feed your immune system. So let's go over this. Cat's claw, I've never taken, but this herb reduces EBV, which is Epstein-Barr virus, which I have very high titers to, and my son literally almost died from. He had myocarditis from Epstein-Barr. People don't realize how devastating that virus can get in taking down your immune system if you do not take care of yourself. And he was involved in fraternity and at college. It was his first year. College, it was a fraternity, and it was football. And of course, there's drinking and all the other eating parts of it. So herbs that reduce EBV, cofactors such as strep A and strep B. Who doesn't get strep throat? Cat's claw. Remember cat's claw. Silver hydrosol. Now I use a silver compound that I use it occasionally. I say use these with the guidance of either a functional medicine pharmacist, a functional medicine doctor, a clinician that understands dosages to your level, and maybe has some blood work that can say, you might be able to tolerate this, okay? They usually are very incremental in addressing anything. So you don't want to overdo it, because then your body will react aggressively, because aggressive responses come with some of the treatments. So now we're going to go back to the other ones that we wanted to talk about. I'm sorry, I had to pause there to see where I was. Zinc. A lot of people are talking about zinc and how to lower zinc. Get enough zinc, because there's been so much out there about zinc, but it might be that you're way overloaded on one other item, that the zinc levels are low. So I wouldn't go crazy, but if you're going to introduce zinc, do it in a moderate form. And so they're saying that this strengthens the immune system, protects the thyroid from EBV inflammation, Epstein-Barr virus. B12 as methylcobalamin. Okay, there's specific types for adenosilicobalamin. Strengthens the central nervous system. We really want to focus and hone in on building up our central nervous system, because I'm going to tell you, most people that were born, their central nervous system is not where it should be, not functioning. And I had bone marrow biopsy, and I had I've had several punctures, to check my CNS fluid, and I did, some of these things were done with medications, yeah, to what? with C-sections, you're getting injected and you're saying, okay, here's some, that could cause infections. It's an area for infection. But I also was checked to see if I had any CNS issues. And to tell you the truth, I was so dehydrated, they could hardly get any CNS fluid from me. That's how bad it was. So, some of these things are all related to balance. Let's go back to where we are, vitamin B12. Many of the complex Bs can come from eggs. Just believe that you can supplement yourself with the proper foods. Licorice root lowers EBV production and strengthens the adrenals and the kidneys. Lemon balm, antiviral and antibacterial, kills EBV cells and strengthens the immune system. Lemon balm, okay? And, okay, this one, you're gonna laugh. 5, MTHF, okay? Methyl Tetrahydrofolate. This sounds like, folate sounds to me like a B vitamin. Could be wrong. Helps strengthen the endocrine system and the central nervous system. Now, there are some people that have something called, I call it the MFR gene, where their genes aren't working properly to be able to follow the proper steps to break down certain things or build up, do the B vitamin routine in your body. There's some genetic mutations or flaws or little things that might prevent you from these things being properly working in your body for your immune system. So there are doctors that are specific to those areas, and I'll put Dr. Ben's name and his information because he's all about the MFR gene, MFHAR, MTHAR, FR, the mother effer gene, I call it. Okay, let's go to selenium. Selenium, believe it or not, is found in nuts. And the nut that most people don't realize it is beneficial for them is Brazil nuts. You may not need a lot of Brazil nuts, maybe 1 or 2 a day. It's just like medicine. And if you add these occasionally along the way, they not only help you with your fat that your CNS needs, your central nervous system, but also for selenium. Now, red marine algae is a powerful antiviral that removes heavy metals such as mercury and reduces viral load. L-lysine lowers EBV load and acts as a central nervous anti-inflammatory. Now, I'm not certain because I'm still learning about the connections with food and so L-lysine. I've seen L-lysine in with some vitamin C. So I've seen that compounded together. I also see L-lysine or lysine in eggs. So am I, is that the same thing? Learning more about that. I eat an egg or 2 a day. So those things, I usually eat them at breakfast, but there's sometimes I eat at a different time. And those are things to consider to help with virus. Spirulina, it says preferably from Hawaii, rebuilds the central nervous system and eliminates heavy metals. All of these are helping for elimination. Ester C strengthens the immune system and flushes EBV toxins from the liver. Liver can be overloaded with virus, and that's where all the hepatitis come from. It's inflamed, hepatitis A, hepatitis B. So if you build up your immune system, you're less likely to have issues related to any of those hepatitis types, those different types. You want to build up the immune system so that the blood system's working, so that the liver and your organs are all working, and really make sure your CNS canal is working well with all the electrolytes and fluids it needs for it to function. You need that proper amount. I've taken care of people that have had valves in their brains. I've taken care of so many situations, and I don't want to see you there. So I'm praying for you. Nettle Leaf provides vital micronutrients to the brain, blood, and nervous system. Now, I have not tried all of these, but I can tell you that what's not on here is oil of oregano. I want to tell you that the herbs that we season our foods with, the fresher the better. You don't need a lot. You need small amounts. And some garlic. Garlic is wonderful for the body. Small amounts. They even say that garlic, that a mother who nurses her baby has benefits for the baby to even want to eat more. So all these herbs have a purpose. And many of the herbs from different turmeric, that's not mentioned on here, but these Epstein-Barr viruses, these are huge, even with COVID. You just want to focus on maintaining a diet, maintaining good choices that don't stress your organs. And unfortunately, we have relied on pasta and all those high carb foods that are really detracting you from being well. My name is Diane Greco-Allen. I'm a food relationship coach. I'm a survivor of acute pancreatitis several times, and I want to help you recover or to get out of pain and find the ways that you can do it. And I hope that you learned something tonight with this episode. Please just put anything in the notes below. I hope that my share screen worked tonight and that you will make some choices, better choices. You can check me out on For the Health of It. My new brand is DDS, which is Digestive Distress Solutions. Functional Medicine Certified Health Coach, Diane Greco-Allen. Thank you.